Well, good morning, good morning. This is Dr. Bulow with Revive, and once again we're doing a weekly research review. This research review actually started with a journal that came out of the Frontiers in Neurology in 2016. And it's actually a pretty widespread journal, so we're going to break this down into a couple different sections. Today we're just going to talk about defining concussions and post-concussion syndrome. So this would be a good starting place if someone is wondering if they have a concussion or if they have a family member that they think might have had a concussion, right? So here's the tough part about concussions. There is no current objective test for it. Most of the definitions that I'm going to go over right now are based more on the symptoms that you're having following some type of physical trauma or blow to the head, okay? So if you've had a sports-related concussion, it would be an accident, where the helmet got hit, or maybe you just fell and you hit your head, or maybe you were in a car accident and there was a severe whiplash where the brain could have been shaken within the skull. At the end of the day, there's some level of physical force, concussional forces, that shakes or impacts into the head and the brain area. After that, this is how it is defined. The two main diagnosing bodies here. The first one is the DSM manual. It's the psychiatrist's manual for diagnosis, and what they define it as is if you have a decrease in your cognitive or memory function. So let's think about that. If you are not able to say how many fingers am I holding up, right? That could be visual, but you can also have to cognitive to think about it. What's 2 plus 2? You should be able to figure out that's 4. Or what day is it today? What's your name? Where are you located? Right? Those are cognitive and memory kind of things to see if the brain's working. So number one, if you don't have the right cognitive or memory function, and number two, to have the diagnosis of concussion, you have to have 3 or more of the following. On top of decreased cognition and decreased memory, 3 or more of the following: headache, dizziness, fatigue, irritability and mood swings, changes in your personality, or changes in your sleeping patterns. 3 or more of those. Now, similarly, the World Health Organization defines a concussion based on symptoms, where you have to have 3 or more, this might sound familiar, headaches, dizziness, fatigue, irritability, sleep, concentration, and memory. So the only difference there is the DSM, the psychiatry definition, says you have to have cognitive and memory plus all the others, where the World Health Organization says you just have to have 3 or more, whether it's cognition and memory or headache or fatigue. So let's just do the World Health Organization, because they're the ones who define your current medical guidelines and diagnosis codes that your medical doctors use. And basically, let's just go over that symptom list again. And all you need is 3 or more following a physical injury, and it should be within the first month following that injury. So whether it's a car accident or a sporting injury or something like that. So within the first month following a physical trauma of some kind, do you have 3 or more of the following: headache, dizziness, fatigue, tiredness, irritability or mood changes, aggressiveness, depression, things like that, changes in your sleep patterns, decrease in sleep, decrease in your concentration, like a child being able to focus on school or an adult at work, or changes or decrease in your memory. Now here's the thing. That's your definition of concussion right there. The research shows that the vast majority of patients will clear up. The brain will heal within 1 or 2 weeks. Most of it in the first 7 to 10 days. But children, school-age kids, tend to maybe take a little bit longer for the physical symptoms, maybe 2 weeks. Now, this is because the brain is incredible, and the human body is incredible, and it can rebound and come back pretty fast. But there are about 10 to 30% of the people that have these concussions, 10 to 30%, where the symptoms go beyond the 2-week cutoff point. When those symptoms go beyond the 2-week cutoff point, they get a new label. Instead of just having concussion or traumatic brain injury or something like that, they are then given with the label of post-concussion syndrome. So now we have these symptoms, 3 or more of that list, going beyond 3 months. And let me just give you a little hint here. Anytime that we say the word syndrome in healthcare, a lot of the times, maybe not any of the time, but a lot of the times what it means is that the provider, the healthcare provider, or the professionals at large don't have it all figured out yet. And so you're labeled with a syndrome. So maybe it's chronic fatigue syndrome, fibromyalgia syndrome, restless leg syndrome. In this case, post-concussion syndrome. You had a concussion, you have 3 or more of these conditions, they all came about within a month of the injury, and now it's been over 2 weeks and they're not going away yet. And so now you have this new diagnosis, post-concussion syndrome. That is a very significant diagnosis. What it means is that there's something wrong lingering in your body that is keeping your body from healing. And there's a vast array of approaches and things that we can do to figure it out. We advocate one of your options be a proper evaluation by an upper cervical chiropractor, someone who's going to look very detail-oriented at the upper neck. Because usually, when you have a concussion, you get a whiplash effect in your upper neck, and that can keep the brain from being able to heal and recover. So, I hope that this video was educational for you, gave you a starting place to understand how a concussion is defined and how post-concussion syndrome is defined. And if you know anyone that needs this information, please share it with them. If you have any questions, please ask them in the comments associated with this video. And if we can be of any service to you or find you a provider in your area, please don't hesitate to contact us. The biggest thing we want to do is just to help those in need. So thanks for watching, and we'll talk to you guys next time. Bye now.